Welcome back to the Sky News Daily. Niall Paterson here. And today our focus is very much on Labour and their plans to sort out healthcare. You certainly don't need me to tell you that the NHS is in a bit of a state right now. And neither does the Prime Minister. In fact, soon after entering Number 10, he commissioned Lord Darzi to provide an overview of the health service. Lord Darzi was himself formerly a health minister under Gordon Brown. His conclusion, the NHS is in critical condition. As for the cure, well, later we'll be taking a look at how technology, and specifically AI, will be part of the drive to improve the NHS. But first, here is Sir Keir Starmer launching his government's 10-year strategy to save our health service.
It's reform or die. So this government is working at pace to build a 10-year plan. Something so different from anything that's gone before. This plan will be framed around three big shifts, three fundamental reforms, which are rooted in what Lord Darzi has set out today.
Well, listening in to Sir Keir Starmer was our health correspondent, Ashish Joshi. He's now left the venue and come out to talk to us to give us his view. I mean, first and foremost, I suppose, we need to start with that assessment by Lord Darzi about the state of the NHS. I mean, did we learn anything new apart from it's really bad?
It depends on who you mean by we. Not very much of what Lord Darzi says is new, because this data is available, this data is made accessible, and the trusts and the organisations like NHS providers talk about this almost every time. If you go to any of the Royal Colleges, the ones for GPs or for surgeons, they will tell you what a dire state the health service is in on an almost weekly basis. So is it new? No, but does it need to be said? Yes. And there would have been detail, perhaps, that Lord Darzi had access to that hasn't been made accessible in the public domain. But largely, yes, Neil, we knew what state the NHS was in, and almost every aspect, from cancer to mental health services to children's care to respiratory diagnostics, all of this is well documented and the data is out there. The question is, of course, what do we do when presented with this evidence in this quite blistering report?
Yeah, I mean, ultimately, we can sum it up pretty quickly by saying, you know, the nation's health has literally deteriorated over the past 14, 15 years, which has led the Prime Minister to seemingly channel Arnold Schwarzenegger and say of the NHS, you must reform or die. I mean, let's put the hyperbole to one side. What exactly is his plan?
He says he's talking about a 10-year plan for the NHS to reform. When he talks about reform, he's talking about moving, I suppose, the budgets and the focus away from acute hospital settings to in community settings, bringing out things like community diagnostic centres onto the high street. So people don't need to go into the hospitals to have not just their blood pressure, but CT scans, blood tests, go to see their physio and go and see an array of specialists. And this has been talked about a great deal in the past, bringing health back into a community setting through these centres or through a GP, so that keeps the pressure away from an acute hospital setting. People should only really be going to hospitals if they have an emergency. That's the aim, that's an ambition, but it's going to take a long time. One, you'll need capital expenditure, a lot of it, and then you need to identify these spaces, you need to invest in the equipment, and you need to make sure that you have the staff to run these centres.
Just on that, in terms of capital expenditure, look, we're all getting a bit sick of hearing from Labour about the £22 billion black hole in the nation's finances that they still can't actually show they're working on. But now we discover that there is a capital expenditure shortfall within the NHS of what? Let me just have a look at my notes here. Oh yeah, 37 billion. I mean, I get the ambition to move from hospitals to community settings, but that's going to take an awful lot of money, which it appears they do not have right now.
They don't have the money. He said as much in his speech today. He said money would be made available because that's what a Labour government does. It supports the NHS, but only if the reform took part at the same time. So without reform, there will be no money for capital expenditure. When they talk about the hospital budgets, they say it doesn't match the productivity. The amount of money being spent on hospitals, you don't get the productivity, i.e. patients don't get treated quickly and are not well cared for with the amount of money that's being spent on the hospital budget.
Yeah, and another of Sir Keir Starmer's ambitions is that perhaps people will just not be going to hospital in the numbers that they have in the past. Prevention rather than treatment. Again, something I have to say, I think I have heard before when it comes to talk about the NHS and changes to it moving forward. But again, this is one of the ways in which they think that they are going to be moving the NHS away from being, as Lord Darzi says, in a critical condition.
This is probably going to be one of the most contentious areas for Labour with its 10-year NHS plan. And that's because we've seen already the fallout with Labour's smoking plans. It's saying people can't smoke in public spaces. We have to make sure that by the time the next generation hits 16, you just simply can't smoke. And he will have a similar ambition for sugar, for fatty foods, because obesity is at crisis levels. He's talking about obesity in children already. But he knows when he starts talking about the government or the state imposing on people's free will and choices, that is going to be very difficult. You're going to get a lot of pushback. It's a very complex area, very contentious. That nettle really does need to be grasped. And it wasn't today, but it was certainly alluded to.
The plan, as I understand it, prevention rather than treatment as far as possible, that care to be provided in the community rather than in hospitals, all of which, as I've said, I have heard before, the third kind of prong of the Keir Starmer strategy is, bringing in technology. And again, haven't we been here before when it comes to the NHS and digitalisation?
Yes, we have. And you're right, we've heard the other things mentioned before in the past as well, community settings and prevention. They're no-brainers. There is a revolution taking place in the digital transformation of the healthcare sector, but it isn't happening as quickly as many people would like to see in the NHS.
In a moment, we're looking at exactly that, how tech and AI could be just what the health service ordered. Sir Keir Starmer thinks the NHS needs to reform or die. He hopes that focusing on prevention rather than treatment and moving treatment out of hospitals and into communities will go some way to sorting the huge institutional issues that plague our health service. But according to those already active in the sector, technology and AI offer huge opportunities too, if only we try. Dr Ben Maruthappu is a medical tech entrepreneur, also the founder and CEO of Sera MedTech. Ben, look, you have been working in this area for quite some time. So how did you get started?
So I used to practice in the NHS as a doctor, and back at the start of 2016, I actually had to organise care for my mother after she fell and fractured her back. And that was a really challenging process for me because I was calling out different home care agencies. I was trying to find someone who could look after my mum. It took me ages to be able to do that. So in the meantime, my sister, aunt, and I ended up looking after our mother ourselves. And then when we finally found a home care provider that could organise for a carer to look after my mum, we got this revolving door of different carers visiting her. I wouldn't even know the name of the person who's coming to visit if there were any issues happening. Or how the quality of care was going. I tried to contact the home care agency, but half the time they wouldn't pick up the phone. It was just all around a pretty poor experience. And when I looked more closely at these home care companies and organizations, I realized the staff are very well intentioned. They do want to go above and beyond for patients, but they're limited by the tools of their organization because they're mainly run using pen and paper and whiteboards. Some of these organizations even have patient records in bin bags. Let alone trying to put it in filing cabinets. I just thought, how can it be so backwards? How can it be so antiquated? Surely if we use technology in this sector, we can make it run better, empower staff to look after patients, and allow quality of care to improve as well. And so that was the motivation for building and launching Sera. a handful of years ago.
Okay, so tell us just a little bit about what you do specifically at Sarah.
So our ambition at Sarah is to take healthcare from hospital to home using technology. We organise for thousands of carers, nurses, and physiotherapists to visit patients where they live, so they don't need to end up in hospital or go to a care home or elsewhere. We've built technology that allows us to do this at scale. So we now deliver over 2 million patient home visits face-to-face every single month. That's the equivalent of scale all of the NHS A&Es in the country per month. And we have used technology and built AI that allows us to predict health issues before they happen, so we can intervene early and stop people ending up in hospital unnecessarily, reducing hospitalization rates by up to about 70%.
Ben, I wonder if you should be hanging by the phone expecting a phone call directly from the Prime Minister, Sir Keir Starmer, given that of the three strategies that he has outlined today in terms of sorting out the health service, moving treatment into communities and away from hospitals, the digitalisation of the health service, and indeed using technology to make it better. I mean, both of those seem to be pretty much right up your company's alley.
Yes, we do focus on those trends. And I would say that the shifts that the government have outlined are quite similar to what other health systems around the world have started to push for as well, because there is quite a consensus about how healthcare needs to change in the UK and elsewhere for it to be more sustainable, for it to meet the needs of an aging, growing population, and for it to close the gap on these demands when you've got staff shortages. I think we just saw it a bit earlier on and took the leap into trying to build a company that solves some of these challenges.
So where then do you see within the health service as it's currently constituted the opportunity for tech to make a real difference? Because look, the health service again has tried to do that in the past, perhaps not 100% successfully, admittedly.
You're absolutely right. I think there have been a number of national IT or digitization programs that unfortunately have not succeeded entirely as they wanted to. And some of the challenges behind that are they haven't always been user-centered. So if you think about the technologies or the apps you may use, they're normally pretty intuitive. A couple of clicks without having an instruction manual, and you know how to order a cab using an app or get some books delivered to a door or manage your bank account. They don't have an instruction manual. It's just plug and play. The technologies we've seen being rolled out in the health service in the past have been much harder to use, and they almost get in the way of what frontline staff need to do. If you imagine a busy GP who's managing their clinic, and then they've been asked to use this new piece of software or this new system, it's another headache for them. It's not solving issues that they have on a day-to-day basis. It's not necessarily helping them do their job better. We haven't really focused technology explicitly on how we empower staff and how we address some of the pain points in the system. Technologies are more available now that address this. I think what's also particularly exciting right now is the prospect of AI. And we've seen AI already have a significant role in many other industries and sectors. It does have a potential role to play in the NHS. It's not going to solve everything, but it does have a role to play in addressing some of these pressures.
Tell me exactly where you see that, because of course, whenever anyone hears AI and NHS in the same sentence, you know, people like myself, their minds will instantly go to diagnosis.
I tend to focus just more on the practical ways AI can be used for staff and for patients. When it comes to staff, AI can just help automate simple things like paperwork and the administrative efforts that junior doctors, nurses are having to deal with every single day. At Sarah, we found that by using AI, we can free up about 2 hours a day for our frontline staff. The NHS has over 1 million staff. Imagine if each and every single one of those people had 2 hours extra per day to focus on clinical care. It would address a lot of the capacity challenges, a lot of the pressures we have in the NHS very quickly. And those are boring uses of AI around paperwork and admin. Yes, there's diagnostics, as you mentioned, how you can use AI to diagnose things on an X-ray or a CT scan, but the boring uses, I think, are going to make a much bigger difference in the short term. For patients, AI can also help people to understand what their symptoms might mean. So before they necessarily pick up the phone and contact 111 or 999, there are symptom checkers and AI tools out there that help them get an idea as to what their condition might be. There are also tools that help them manage their conditions. And so AI can support patients so they can take charge of more parts of their health. but absolutely it can handle all of the boring work that frontline staff and NHS staff are dealing with every day so that they can focus more on clinical care.
What would you say to those who suggest that bringing technology into the health services is perhaps just a little bit of window dressing? Fundamentally, one of the biggest problems we have at the moment in our health service, waiting lists and an ageing population. And frankly, we cannot get people into hospital and out of hospital quickly enough because of the social care sector. Fix social care first before we mess around with the IT schemes.
So I think that we've got to tackle this problem on multiple fronts. Right? There's not a silver bullet. It's not just about technology. It's also not just about social care. Even if you just solved social care and made it fully functioning and operating 100%, there'd still be a number of other challenges in the NHS. Millions of people will still be waiting for their hips and knees to be operated on, and we'd have challenges in cancer care that we'd have to address. So we've got to tackle this on multiple fronts. Technology is part of the answer. And in the same way, we've seen technology change how we interact with many other sectors and industries, from our bank accounts to how we order books and clothes to how we get food and groceries, even how we're doing this podcast. Technology has affected it over the past 10 to 20 years. So it can make a difference in healthcare. I do believe that. But other things have to happen as well. We need to address social care, which may involve more investment in addition to changing how it's run. And on top of that, we need to take more services from hospital into the community. Because right now, focusing just on hospitals isn't going to solve the problem. Really, you need to stop people becoming unwell in the first place if you want the system to be sustainable in the long term.
And that is your lot for this edition of The Daily. Do remember, Sky's US team will every Friday from now until the presidential election in November be taking over The Daily. They'll be travelling across the country, meeting voters and digging into the big issues that will decide this election. So look out for that in your feed every Friday from 5 p.m. Tomorrow, they're heading to Springfield, Ohio, to see if people there really believe that Haitian migrants are eating their pets. We'll see you soon.